Good afternoon and welcome to our Kaweah Delta bi-weekly webinar. Today is Thursday, February 22nd. My name is Deborah Volison and I'm the Director of Community Engagement here at Kaweah Delta. We are coming up on our 1-year anniversary of these webinars, and we are so grateful for those of you who tune in every other week and listen to our updates. Our first webinar was on March 19th. And it was a pretty hokey meeting. I don't know if you remember that, Gary. In fact, our first couple were pretty hokey. In fact, one of them, an attendee had their news station in the background, and it kept coming on to our meeting and interrupting our feed. And that meeting, I actually said, I can't take it anymore, and I hung up on everybody. But we have come a long ways since March 19th of last year.
I do recall that now. Now we're in our very sophisticated, technologically advanced Kaweah Delta studio.
Yes.
And we've got Daniel and Maria.
We brought Daniel in. We went to webinar. Now Maria's here. But I will just kind of say to the whole group, every Thursday when we record these, something always happens outside. A couple of weeks ago, there was a car accident. Seems like there's always ambulances. This morning, about an hour ago, they were cutting the cement. And so I was like, well, it's Thursday, it's time for our webinar. But, you know, we're getting used to this. I would like to say that Zoom meetings are getting easier and GoTo meetings are getting easier, but they're still a challenge. And we're still struggling to get through them. But sometimes we have a good laugh at the technical challenges that we have. And speaking of getting easier, Gary, sometimes we're seeing falls, drops in our numbers, and it's really, it's hard to celebrate those drops when we're also seeing high numbers of deaths.
Yes.
And, you know, it's hard to celebrate things reopening when you have controversial subjects like double masking, which we're going to cover today. So we're going to cover some stuff today, and we just want to invite anybody who has a question or a comment to chat that at us. You can also email me or text me, those of you who have my information. But Gary, it's always an honor to sit next to you and update the community. You've been doing these webinars since March 19th, and as we come up on the 1-year anniversary, I hope you're thinking about the gift that you're going to bring me. I don't think he was thinking about that.
Yeah. What's a 1-year anniversary? That's like paper.
1-year anniversary gift. Yeah, it's probably something like that.
All right.
But we're just really, I'm very glad that even in times when we've been overwhelmed or stressed, that you've always managed to keep us all together, and that is a great that's a great trait to have as the CEO. So thank you for that, and welcome.
Thank you. Great to be here. Welcome to you as well. But thank you for those nice comments. I appreciate that.
Yeah. So are you ready to jump in?
I am, yeah. And I think my report this week will be sprinkled with a lot more positive news than maybe some of the more grim reports that I had been given over the last month and a half or so. Because as you alluded to, definitely we are seeing improvement. Not just at Kaweah Delta or Tulare County, but statewide and nationwide as well. So some news of encouragement, definitely. So start at the state level. As you can imagine, the numbers are getting quite large now. We have now tested just shy of 45 million people, or we performed that many COVID tests because people have been tested more than once at times. Oftentimes, patients in hospitals are tested at admission, tested at various points throughout their stay, and then if they're going back to a skilled nursing home, they might be tested at discharge as well. But so 45 million COVID-19 tests have been administered since the beginning of the pandemic, with 3.4 million positive tests in California alone. That translates into a cumulative positivity rate of about 7.5%. But on a very positive note, the positivity rate that the state has been reporting now over the last couple weeks is down to 5.5%. So not in the twos, which we saw back in the fall, but definitely to be down to 5.5% is encouraging. We're always interested in the ethnicity and gender of both those that contract the virus as well as, unfortunately, those that die of the virus. So of those 3.4 million Californians that have contracted the virus, 51% of them female, 48% of them male. Sadly, there have been roughly 45,000 Californians that have died because of COVID. And interestingly, 42% of them are female. So 51% of those that contracted the virus were female, but those that had died of the virus, it's down to 42%. And males are 58% of the deaths. So definitely the male gender has not fared as well in terms of successfully fighting the virus. Those number of deaths equates to about 1.32% of all those that have contracted the virus ended up succumbing to it. So that number has stayed relatively constant. You've heard me talk about 1.2, 1.3. I think the 1.32 is up just slightly from what I reported a couple weeks ago. In terms of ethnicity, also kind of interesting what the data shows, just like the gender differences between contracting the virus and dying of the virus. The same is holding true with ethnicity. So Latinos account for 55% of all those positive cases, but 46% of deaths related to COVID. While the white race accounts for 20% of the cases, they account for 32% of the deaths. So Latinos and whites together account for 75% of the number of cases, which you would generally expect, given those are the predominant races in the state of California. There are currently 11,516 Californians that are COVID positive patients that are currently in a hospital being treated for their COVID related condition. And about almost 30%, about 27% roughly, are in the ICU. So a little over 3,100 hospitalized patients are in critical care. And then lastly, again on a positive note, 5.1 million doses of the COVID vaccine have now been administered to Californians up and down the state. And we'll talk a bit about more locally here. So that's what's going on at the state level. At the county level, we've done 402,000 COVID-19 tests since the beginning of the pandemic. Just shy of 47,000 Tulare County residents have contracted the virus, which translates into a cumulative positivity rate of 11.6%. So 7.5% at the state level, 11.6% here in Tulare County. But like the state, we've seen some improvement, not quite as dramatic. We have dropped down from 11.6 now to 9.9% over the last 7 days. So again, that's very positive. Unfortunately, we're still seeing triple-digit number of new cases every day. So over the last 7 days, the county's been reporting that countywide, we're seeing about 165 new daily COVID cases over this last 7 days. And just to remind you that to move from, the widespread Tier 1 purple, most restrictive category under the governor's blueprint for a safer economy, Tulare County has to average 32 or fewer daily new cases. So at 165, we're still a long ways away. We are, getting close to that positivity rate. You have to be below 8% for generally 14 days. And at 9.9%, we're still over that. But if the trend continues, I expect that we will see ourselves drop down below 8, both in the overall positivity rate, but also with respect to the healthy index as well, the health equity index. Again, both of those have to be below 8. Right now, the health equity positivity rate is at 12.7%. So those areas that have, some of the most challenging socioeconomic conditions are experiencing still a higher positivity rate than the county in general. Unfortunately, we've had now, and Deb, I think you were alluding to this, death is the lingering last measure as somebody progresses through the pandemic. So it's always kind of trailing several weeks when we start seeing positive cases, and then where we start actually seeing hospitalizations and ultimately deaths. So while we're seeing cases drop, deaths are still unfortunately holding pretty steady, anywhere from 10 to 15 a day in Tulare County that are COVID related. So we are now up to 672 COVID positive or COVID related deaths in Tulare County, and about 1.45% of those that contracted are dying from it. So we're slightly ahead of the state, which is disappointing because we generally had been slightly lower than what they were seeing across the state. But it has been rising, and now that puts us at almost 140 deaths per 100,000 population. So it seems like it was just back in the fall that we were in the 60s and 70s, so that number's almost doubled. And then lastly, again, the vast majority of those that have died are over 65 years old. 77% of all the Tulare County deaths were in people that were over 65 years old. So, all right, so that's the county level. Now down to Kaweah Delta, what's happening locally. We continue to still be an incredibly busy hospital, even though our COVID numbers are declining. This morning, 93% of our adult beds in the acute medical center were full of patients. We only had literally 25 beds in the entire medical center that are available for a new admission. Interestingly, the beds that are available are the critical care beds. So this morning, of our 41 ICU beds, 12 of them were open. That's very, very positive news because we had been running at pretty much 100% occupancy. That's why Tulare County and the San Joaquin Valley region was closed down. The stay-at-home order by the governor, which now have all been lifted, and it's because of the increasing availability of ICU beds. ICCU, intermediate critical care, that seems to be the area that is most impacted for us. We have 54 beds across our 3 West unit and our 5 Tower, and only 4 of them were unoccupied this morning. But then also just general medical surgical, 2 North, 2 South, 3 North, 3 South, 4 Tower. They are also seeing a lot of patients. There are 249 beds across those various medical surgical units, and only 9 of them were empty this morning. So throughout the day, we will discharge patients. So I think just the other day, we had 54 patients that were holding in the ED, waiting for a bed to open up. But within a few hours, we were able to accommodate all of them through discharges and making room for those new admissions. Surge beds overflow in the event that we were to have, some resurgence, which we hope will not happen. Sixth tower, so the sixth floor of the Kaweah wing, which is our 23-bed NICU, we are currently using that as an adult overflow unit, but only 5 patients are up there now, so we have 18 of those beds are open and available for adults. And then our endoscopy center, we have the ability to turn it in kind of an open 10-bed ward. But we have not had to do that, so our endoscopy center is in full activity doing endoscopic procedures right now. So that's in terms of the census. With respect to the number of COVID patients, and I almost, when I open up that email and scroll up to that top line, just kind of holding my breath, hoping for a lower number each and every day. And today did not disappoint. We are down to 81 COVID positive patients in the medical center. We were at 170 just about maybe a month and a half ago when we hit that high water mark. And of those 81, only 9 are in the ICU and only 6 on ventilators right now. So again, very, very positive news to report. Same with our employees. I'm asked that question often. Since the beginning of the pandemic, we've had 1,130 of our employees have contracted the virus. That's more than 20% of our workforce. And we've also had 31 physicians, PAs, nurse practitioners contract the virus as well. So pleased to report that we only have 52 of our employees that are currently still out on a COVID-related leave of absence, and none of our physicians or other providers are out. So they've all returned. Very sadly, we have lost now 2 of our employees have passed away from COVID, and one of our providers did very early on in the pandemic. So I think that's it at the Kaweah Delta level. So that gives you a kind of an overview of where we are at the state, county, and local level.
All right, awesome. That's great that our positive inpatients is going down.
Yes.
All right, so a question came in about our the children's program we have at the Lifestyle Center. So can you give us an update on this? Is it still active, and was it beneficial for the families?
Yeah, it is very active. I spoke with Kelly Pierce this morning. Kelly, one of our Kaweah Delta employees, really is kind of the brainchild behind it, she and Diane Cox. And so Kelly is leading that whole program. So it's very active. It has been incredibly beneficial to our staff and their families. In fact, many parents have told Kelly that if not for the availability of this child center, and I don't know to call it a child care center because it's really a school. That's pretty much what they're school-age kids for the most part. And it's a learning environment for them, but it's also an environment where they can socialize and interact with adults and other children. Parents, again, have told us that if it wasn't available, that one of them would most likely have had to take a leave of absence from work or even had to quit their job. So it's definitely enabled parents to both continue working as well as provide all that benefit to the kids. It's really a safe environment. They do incredibly good work at keeping things sanitized, keeping the children socially distanced. When I was out there visiting last, the children are wearing masks, so they know the seriousness of it, and they're following the guidance. It allows for the children to interact with their schools through Zoom. But again, also there are teachers there to help them with their work. So the center is licensed for up to 60 kids a day, ages 5 to 13. We currently have 70 children that are enrolled in the program, and on any given day, roughly 45 to 50 children are physically there at the Lifestyle Center. We do have a little bit of space for new kids if they're any folks out there that are wanting to access it. They really kind of access it on a day-to-day basis, case by case, and they're generally full-time, or actually what Kelly's telling me, full-time Monday through Friday, mornings only, or afternoons only, or even drop-in. So again, if you have a Kaweah Delta, if you are a Kaweah Delta employee, or know somebody that is looking for that child care support, just give us a call, and Kelly will let you know what's available.
Okay, thank you. So one of our local schools is going to start giving their teachers the COVID self-testing kits. Can you speak to those kits? Are they accurate? The results take up to a week, but do you have any thoughts on those?
Okay, yes, I do now. Thank you. Thank you to all of you who asked these great questions. So there are two types of, we'll say, at-home COVID kits. So the one that was most common was the at-home self-collection kit, where you received a kit, and you actually, to receive the kit, you have to have an order from a physician. And that is true of both that I'm going to talk about. That it's actually a prescription-based process so you can't just go online and order it. It has to be prescribed to you. So there's a company called Everly that I happen to, Everly Well is the name of it. And they have an at-home collection kit. It's FDA emergency use authorization approved, but essentially what it comes with is a nasal swab and a specimen collection vehicle that you put it in. But you do the nair swab, so it's not the nasal pharyngeal, but you have to do a really good swab, and it gives you instructions how to do it. You put it in this secure vial, and then you mail that free of charge to one of the designated laboratories that Emory Well is contracted with. And they use a PCR molecular platform, which is the one that has the highest sensitivity and accuracy associated with it. And according to their website and the FDA's letter of authorization, you get your test results back in 24 to 48 hours. It costs $109 for this, and again, you have to get a prescription, and you're actually interviewed, and they go through the COVID questions with you. But it's generally covered by insurance, but it's that one we were hearing about that you just mail off to a lab. But there's also at-home testing kits, which are the complete kit that not only do they come with the nasal swab, but they actually come with the solution that you swirl the swab in, and it does perform a molecular test right there at home. So there's a company called Lucira, Lucira. They have an FDA emergency use authorized at-home testing kit. So again, you swab, you swirl it in the solution, and then usually within about 30 minutes, it displays the results of your tests, either positive or negative. It also is a molecular based, so it's not the antigen based, which is like our Quidel platform, which is kind of the rapid, real-time, you get your test results back in 15 minutes, although they've proven that they're very, very accurate and correlate pretty closely with the PCR tests. But this is the molecular test. They are reporting that they have a 94% sensitivity rate, and that's the ability to identify a positive result. That's what sensitivity means. And then specificity is its ability to detect the absence of the virus, so to confirm that you are negative for it. So their specificity rate, as reported, is 98%. So that, again, correlates very closely to really the laboratory-based tests that you're seeing in hospitals and in county health departments. You cannot order this yourself. If you go onto their website, you have to be a healthcare provider, a licensed healthcare provider. They sell them in cases of 24 individual units. It's $1,200 for a case, which works out to $50 for a kit. But again, you have to have a prescription. So I don't know what the school district is doing. I haven't heard myself. Perhaps they have made arrangements with a healthcare provider or institution to acquire these kits and then distribute them to teachers. We are in the process right now of finalizing an agreement with the Visalia Unified School District that would allow Kaweah Delta to be their testing partner. And we will be testing the teachers on a regular basis as frequently as the school district instructs us. And we will be running it on our PerkinElmer PCR molecular platform, which has been developed in our Blue Room. We've talked about it. That PerkinElmer platform is the most sensitive laboratory test in the entire world. It ranks a number one with a pretty significant gap between number two and all the others that are out there. It literally can detect the presence of the virus at some of the very smallest viral loads. And so that's always the concern, is that you have the virus, you are contagious, but you're early on in your infection, and so these other tests that aren't as sensitive, they're not able to detect the presence of the virus, and so you go about thinking that you're virus-free when in fact you're not, and potentially infecting people.
Okay, thank you, Gary. There's a lot in the news. There's been a lot in the news this week with the CDC saying that schools can and should reopen. The churches have just won a battle at the Supreme Court level about having in-person services. So are you concerned about these decisions and how they will affect the hospital, since our numbers are still pretty high?
I would be greatly concerned if schools and churches were not following the COVID avoidance protocols, because the Supreme Court case and the CDC recommendations for schools to reopen and greater number of churches to have in-church services came with conditions. I mean, you still have to wear a mask. They still have to socially distance. They still have to disinfect. They have to still follow those conditions in order to be open. So if I knew that schools and churches were interpreting these new approvals as just carte blanche now to do what they would do pre-pandemic, I would be greatly worried, because I think the risk of outbreaks would be significantly high. But at the same time, I'm also greatly worried about our children, their mental and physical well-being. Just what we're seeing out there, the number of adolescents, that are coming to our emergency department with suicidal thoughts and just great depression, and I think school and church are incredibly important elements of children's lives, and I think, while I certainly would not ever want to put a child at risk, what we read is that for those schools that have remained open in other parts of the country, or some of the private schools, that because they have followed the precautions so well, they've had little to no infection spread. I'm glad to see that they're opening up. because I think it's important, again, for the mental and physical well-being of both adults and children. But I really implore them to continue practicing, the protocols that will keep them well and safe.
Yeah. So the same argument could be made for our lifestyle center. I
Yeah.
was with a community member the other day, and he was like, I've got to get back to the gym. It's affecting my mental health. My physical health is affecting
Yes.
my mental health.
Yes.
And so I know the lifestyle center it feels like it's worlds away from
Yeah.
opening, but that same argument could apply there.
Yeah, it can, and I have just as many people come up to me
Yeah.
and grab me and say, Gary, please, please, make it open, and again, I was a big fan of the Lifestyle Center, a member for eons, and I miss it terribly as well. And it's very frustrating because this one gentleman I spoke to, he goes, I need to know when are you going to open, otherwise I'm going to quit and go join another gym. And I know when he says I'm going to join another gym, I'm going to join one that's open, that's defying the governor's orders, that is not following. I don't know if I'd say it's a law, but definitely the executive orders, and it's frustrating for our staff, Patrick Tazio and Jag, and we're all frustrated that we're following the orders, and we're a public entity. We feel kind of a sense of obligation there, and we don't want to expose our members to risk. We want to keep our community safe, and but it does bother us that they're open and we can't. And unfortunately, gymnasiums are not allowed to open until a county has moved out of Tier 1 purple into at least Tier 2 red, which I talked about. 32 or fewer cases a day and positivity rates of under 8% for us to move there. And once you do move there and you stay there for the required period of time, generally 14 days, then our Lifestyle Center can reopen, but it will be limited to 25% of its licensed capacity. So if its licensed capacity was 500 people, in the Lifestyle Center at one time, we'd be at 25% of that. When you move into then Tier 3, yellow I think it is, or orange, then you're allowed to move to like 50% capacity. So I was telling Jag the other day, to me it feels like maybe we're 3 weeks away, something like that. Yeah, this is being recorded, isn't it?
That made me so happy, though. I was like, 3 weeks away.
I try not to make predictions, but if you just start, looking at the models, unless we have that Super Bowl surge, which I'm really hoping we don't. If we continue, on the path that we appear to be now, that we should see that positivity rate pretty shortly drop below 8%. We've definitely, as a county, we've been down in the 5s, so we're capable of doing it. It's a number of new cases, and certainly with these variants that we're identifying around the country, that's the only cautionary, I guess, note I have, is that I do worry about that, because that's an unknown in terms of how that might impact us.
Yeah. Well, mark your calendar, Daniel. 3 weeks. Okay, so testing numbers. We're still doing quite a bit of testing, but has that declined?
No, it is not, and that's a good thing. I just got a report from Ryan Gates, our Vice President of Population Health Management, and Ryan oversees the COVID-19 testing program for Kaweah Delta. So January 2021, we performed 18,182 COVID tests. It was the highest number of COVID tests we have conducted in any month throughout this pandemic. Second was December at 17,676, and November was third at 10,752. So actually over the last 3 months, we've done the greatest amount of testing over the entire year. And already in February, today's February 11th, I think it is, we've done 5,200 COVID tests. So we might be on pace. It probably won't hit what we did in January and December, first because we only have 28 days in the month of February, but it's still going. Our rural health clinics, our urgent care centers, the Lifestyle Center parking lot, which we moved from Court Street over to there, all very, very busy and still welcoming, encouraging anybody that wants to come get tested, symptomatic, asymptomatic, just come on by.
Okay. So are we planning on reopening our non-emergent surgeries back up?
We have. And we're planning to open it up even a little bit more here, but being very, very cautious, opening up very incrementally because, as I mentioned, we're still at 93% occupancy. So that really is what determines how much elective surgery we can do. It's just our ability, particularly for inpatients, just our ability to to support that inpatient care. So back on February 1st, we resumed elective surgery and procedures. We initially started off allowing 6 elective inpatient surgeries per day, and then really an unlimited number of outpatient surgeries and procedures, as long as we had a very high degree of confidence that it would not result in an overnight stay. We're looking this coming Monday to increase that to 10 elective inpatient surgeries a day. Again, all contingent on just the general occupancy of the medical center. Great to see that happen.
Yeah, fabulous. So I wanted to go back to a topic that came up 2 weeks ago on this webinar, and it was asked about Dr. Fauci's support of double masking. And so we responded to this 2 weeks ago, but things have changed since your response. So do you want to give us an update on double masking and let us know where we would go from here?
Yeah, so 2 weeks ago, I did respond, and as I commented back then, I think Dr. Fauci's remarks were largely in response to these variants that we've seen in Brazil and the United Kingdom and South Africa, and that they're more contagious, they spread more easily. Don't know if they necessarily result in more hospitalization or death. The South African and Brazilian variants appear to be more elusive in terms of staying out of the path of our COVID antibodies when we have been vaccinated. So that's why most of the drug companies that are manufacturing the vaccines are already developing boosters and things to try to more directly impact the variant. Although every indication is that the current vaccines that are being administered are effective against these variants. So Dr. Fauci basically saying that, and he really wasn't speaking to healthcare workers, he was speaking to the general public, who for the most part are wearing a cloth mask or a general or surgical mask by themselves, just a single one, which does provide a great deal of protection. But obviously, if you put a second mask over the first mask, it does provide additional protection. But, the more masks you put on, why stop at 2? Why not wear 3? Why not wear 4? More and more and more protection, which is actually what they've said. But then you have difficulty breathing and all kinds of other probably issues. But when I spoke a couple weeks ago, I said, we're not going to adopt Dr. Fauci's recommendations that Kaweah Delta has consistently, from the beginning of this pandemic, we've followed the recommendations of the CDC. Well, lo and behold, the CDC, I don't know if it was this week, has come out supporting Dr. Fauci's recommendation. They actually conducted some experiment using, they called them dummies, so not real people, where they single masked them and double masked them and replicated coughing and spitting and to see, how the virus, traveled and how effective one mask versus two masks were. And they concluded that, in fact, wearing two masks, wearing a cloth mask over a surgical mask does provide protection. But they also came out and talked about actually a couple other things that you can do. One is tying a loop right next to the mask so that the whole key is to fit tighter against your face. So when you're wearing just a surgical mask, it kind of does pooch out to the sides, which allows, those molecules, I guess if somebody came up behind you and coughed and propelled it forward, it could come in through the side of the mask. So if you go onto the CDC website, they'll show you, how to tie the mask to create a tighter, fit against your jaw and your cheek. But they're, it's a recommendation. They're not advocating wearing N95 masks for non-healthcare workers. Really, I think what they're advocating is the better fit that you can create, and putting a cloth mask around a surgical mask is going to make that surgical mask probably fit a little bit tighter to your face. And really that was what I took away from the CDC's report. But we're not going to ask our healthcare workers at this time to wear double masks. In fact, healthcare workers that are working with our patients are pretty much all wearing N95 masks that have been perfectly fitted to their face. We also, we still are allowing visitors, and certainly visitors that want to wear double masks, well, they're welcome to come in that way. We do want to make certain that visitors are wearing their mask properly, because the last thing we want to do is have a visitor who's contagious and asymptomatic come to see a loved one and pass the virus on to them or to our staff. So we do ask visitors to please wear your masks appropriately, and just not when you're being screened, when you're actually up on the unit, when you're in the patient's room, wear your mask properly the entire time.
Okay, thank you. So we've answered all of the pre-submitted questions, but a couple of topics just rolling over in my head. So the vaccines, are they more readily available for community members? I know we're not offering them yet at any of our rural clinics, and everybody still has to go through the county. But there's been a lot of frustration out there. Are you seeing more of an abundance of vaccines coming into the county?
The county, I think, reported that they're receiving about 4,500 doses a week.
Okay.
That's the allocation that they're getting. To date, they have received 49,000 doses, and they've administered about 33,500, somewhere in that neighborhood. So a lot of vaccination is occurring, not as fast as we need it to occur, but that frustration you just referenced continues in abundance, frankly, because earlier this week on Monday, in fact, I got a text message over the weekend from the president of the California Hospital Association asking me to participate in a statewide call with many other hospital CEOs and CHA and the CEO of Blue Shield of California. And we were all being informed that the state has now entered into an exclusive agreement or arrangement with Blue Shield to essentially take over the management of vaccinations throughout the state. So up until this point, it's been the state working with the individual county public health departments to secure and administer the vaccine. And while every county, including ours, experienced some hiccups, when they were first launching, it's actually been running very well, and I give a lot of credit to Tim Lutz and the folks at the Health and Human Services Agency. I've heard great feedback from people that have been getting their first and second doses out at the Tulare Ag Center, the drive-through lanes that has been working just beautifully and well organized, and now that's all going to be taken away. So now the counties are basically being told stand down, and Blue Shield's going to take over. And Blue Shield, through its provider network of hospitals and clinics and doctors, they want the vaccinations now to be done through the provider network and no longer through the counties. So this week we've been working on, okay, how do we support that? We are preparing ourselves to be able to vaccinate patients of Kaweah Delta, patients of our clinics, Visalia Medical Clinic. We are working and do expect in the fairly near future that we will begin vaccinating our patients. But we also likely will be, working again with Blue Shield on running these mass vaccination events. But it is very frustrating because the county had already entered into an agreement with the Ag Center, who canceled certain events to make the Ag Center available to the county. And how do you undo those? And so it does appear by all accounts that the state is going to move forward with this, and I know a lot of counties are frustrated and upset by this, and unfortunately I think it's the state, is a knee-jerk reaction to their frustration that more people aren't getting vaccinated, and somehow they think if Blue Shield steps in and starts, actually managing the inventory, is the one that is making the determinations of who gets vaccine and how much they get. They believe that they can do a much more effective job with it.
So when you say provider networks, that is each person's individual physician?
Yeah, and hospitals.
Okay.
So what it looks like initially, so I'm on this call with the CEO of Sutter and Kaiser, Cedars-Sinai was on it, Stanford, UCLA. So we're all part of the contracted provider network to Blue Shield. And so Blue Shield's plan is working with its major hospitals, and they've selected Kaweah Delta as the hospital provider for Tulare County. So they will have, one or two major hospitals in each of the counties essentially become, the manager of the vaccination process. So I fully expect that we're going to continue to work with the county and how do we continue to partner together to do this. But again, those details haven't been released yet. But then also, I think the hospital will be encouraged to work with Blue Shield's network of physicians, because most of the physician medical community throughout Tulare County is contracted with Blue Shield. And so they will want vaccines distributed to their contracted providers to give to, not just Blue Shield members, but to the entire community as well. So I hope this doesn't slow us down. I mean, they're doing it because they think it will speed it up, but everything's contingent on the amount of vaccine that's coming from Pfizer and Moderna. They're still the only two drug companies that are producing the vaccines. I think Johnson & Johnson, the FDA will review their application for emergency use authorization on February 28th, I think is the schedule.
And that's a one dose. Somebody just chatted about that. So that's a one dose.
One dose.
82% effective.
Yeah. And again, just to remind people that while these vaccines do help prevent you from contracting the virus, they're not guaranteed. They were really designed to prevent you from getting really ill from the virus. So when it talks about 82%, it's 82% effective in keeping you from getting
Really?
moderately to severely ill, not 82% protecting you from not getting the virus. So you can still get the virus, you can still be contagious, you can still spread it to other people, but you're highly unlikely now to get sick from it yourself, you know, and end up being hospitalized or dying.
I think that's a frustration. I know it is for me, and I hear it from others that, you know, you get the vaccine and you really want to just go frolic in the fields, run
Right.
around unmasked because you now feel like you should be safe because
Right.
you got the vaccine, when
Right.
in fact that is not
But
reality.
think about the flu.
Right.
So every year, you know, scientists, laboratories, drug companies are trying to figure out what are going to be the strains in this year's flu. And so they create a vaccine, and you know, 95% of the people that work at Kaweah Delta, or if not more, get vaccinated. But it doesn't guarantee that you're not going to get the flu. In fact, often the flu vaccine is only 25% to 50% effective in preventing you from getting the flu. But if you do get the vaccine, generally, and you do get the flu, your symptoms are generally milder. You know, you get over it quicker. You generally never end up in the hospital. I was talking to our manager in infection prevention. 95% of the patients that were hospitalized last year at Kaweah Delta for the flu were unvaccinated. So it really kind of underscores that, you know, vaccination and avoiding the hospitalization with the flu go hand in hand. The difference is when you get the flu, number one, you pretty much know you got the flu, and everybody around you knows you've got the flu, and to stay away from you because you're contagious. And you stay away from people. So unlike COVID, where you could be infected, contagious, and not know it, feel great, and be giving it to other people who may not, you know, have the same ability to fight it, or may not have been vaccinated from COVID or for COVID. That's why we don't keep wearing our masks during flu season. We don't wear masks, and we still gather and hug and kiss and dance and go to parties and everything. And if we get the flu, you know, we get the flu. And but COVID is so different, and that's why really it's going to be when we hit the 70-80% herd immunity that either is going to come from vaccination, or you became infected and developed your own immunity. It's really everything I'm reading that until we get to that 70-80%, we're going to have to continue to wear masks and not frolic in the field like you described there.
Well, Dr. Nguyen was pointing out the Johnson & Johnson vaccine, and we're expecting vaccines to just increase substantially once Johnson & Johnson releases their vaccine.
I think the federal government has ordered 100 million doses of the Johnson & Johnson vaccine. So, and we're looking, you know, to Pfizer and Moderna to continue manufacturing more and more vaccine. I think when we have Johnson & Johnson on the market, there'll be much more availability of vaccine, and we'll have to, you know, make a choice of what vaccine do you want to receive.
Right.
The Pfizer and Moderna vaccines that have 94 to 95% effectiveness, that's to prevent, again, moderate to severe illness. They are both 100% effective in preventing death from COVID, according to their health report. So obviously, I mean, that is the real benefit of the vaccine. Getting vaccinated is that you significantly improve your chances of not getting really ill in the event you do become infected.
Okay, so an employee asked a question for the employee huddle tomorrow that I thought would be interesting for this conversation. Has the county established any kind of database where they are now tracking positive cases that have received the vaccine? Do we know if anybody in our area has tested positive even though they've... Because I know you go into the system if you're positive, and then I know you go into another system if you've received the vaccine.
I don't know. I don't know the answer to that. I have heard one story where a person received their first dose, and before they'd received their second dose, they became infected. So they got exposed and became infected. I think Pfizer was reporting that even after the first dose, you had 57%, protection. But again, that's from moderate to severe illness, not preventing you from getting the virus. So, I don't know if they will track that information, because again, I do think one of the things that I talked to Randy Coca about, Randy's our director of our lab, is he wants to do some antibody testing. So he wants to take some blood samples from a segment of our hospital population, our employees, and those that have been vaccinated, had both vaccines, and now are at least 2 weeks out from their second dose, to test for their presence of antibodies and to see how prevalent they are. Because even the antibody testing that we were doing last June, just people that wanted to see if they'd had the virus, and I think we ended up only about 3.5% of the 3,000 people we tested had antibodies. We even found people that had COVID, definitely had tested positive, that had no antibodies. But our laboratory analyzer is actually, it produces a number. It actually tells you, just how significant, how abundant the antibodies are in you. And it can vary. And it did back in June when we were testing people. But we'd kind of like to get a sense of, so somebody like me who got both doses of Pfizer and I felt no side effects whatsoever. And then I talk about Diane Cox, who after her second dose had pretty moderate to almost severe side reaction. Disappeared in a day, but she had, the chills and the body aches. And I've talked to a number of people that definitely got that after their second dose, spent the day in bed. And so it'd be interesting, does Diane have a much richer presence of antibodies than I do? Or do I have
Or did you
any?
already have them and the vaccine didn't have to?
Well, I doubt it. I really doubt that I ever
Well, like
had
for
the
me,
virus.
I had COVID in December and I've taken both vaccines.
Yes.
Did not get sick. My arm hurt a little bit. So it's
Right.
like, was I already?
Are you curious about your
I am.
antibodies?
In fact, I just wrote a
I know.
note to call Randy.
Yeah, I'm curious too. I think we'll have a lot of volunteers.
Yeah.
But you're almost afraid to know the results.
I know.
What if he comes back and says, yeah, Gary, you don't have any antibodies?
Yeah.
So.
Yeah. Okay, well, thank you, Gary. We are getting ready to conclude. I do want to just say I want to thank the community for the outpouring of support that they continue to show. I don't know if you follow our Facebook page, but a community member purchased 100 boxes of Girl Scout cookies yesterday, and the little girl she purchased them from was here on our campus handing them out to our staff members, so that was really exciting.
Neat.
A couple of weeks ago, County Center Rotary did a walk around and brought 500 burritos. Tomorrow morning, Visalia Sunset Rotary has organized a multi-club event, and they are coming to 4 of our campuses and handing out over 3,000 goodie bags to staff members at 4 of our campuses. So thank you so much if you are a part of those organizations, because it gets a little tough around here sometimes. And those things just really lift our staff. And so we're very appreciative of that. But Gary, I'm going to let you close with some words of inspiration.
You just said them all. I would just like to echo everything that Deb just said. Just thanks to the community. Thank you to all of you for your continued support. Participating in these bi-weekly telecasts and asking your great questions, because not only do I answer them for you, but I share this information with the entire community through our Facebook page and other social media, and oftentimes this is information that our employees are interested in as well. So thank you for that, and again to Deb's point, thanks for just continuing to express your appreciation with your generosity. You know, doing the drive-bys and the honking and the march around the campus, and you really do bring a smile to our employees' faces, our providers. Just knowing that the community is thinking about them and caring about them really does help them get through some pretty tough days. So I hope you all stay safe and healthy and have a great weekend. President's Day, so we get Monday's a holiday, but continue to do all the right things that you know what you're supposed to do. So we'll see you in a couple weeks.
Thank you.